So I want to talk to you about how a very rare thing comes to us, which is cryopyrins. And it is what the name suggests. It's cryo and pyro. Cryo means cold, and pyro means hot. So the protein cryopyrin leads to the manifestations of the cryopyrin disorders, which are periodic, and the cold usually produces urticaria, which is hives, and the pyrin is the recurrent fever. So when we have that combination of cold-induced and recurrent fever, that's cryopyrin, because it's both hot and cold. And the way this comes to us is usually chronic recurrent inflammation, because it's an inflammatory disorder. And the most common is conjunctivitis, but it can present with uveitis, and in the posterior segment it might produce optic disc edema. And so that's how it comes to neuro-optic disc edema. It can also deposit in your cornea, and the corneal disease is very non-specific, and some of these patients end up with penetrating keratoplasties with no diagnosis. It's a congenital hereditary disorder, and we have the genes, so the genetic tests are done, and there's a spectrum of these cryopyrin associated periodic syndromes, from mild to moderate to severe. The most severe forms are the neonatal onset multisystem inflammatory disease, NOMID. The middle version is called Muckle-Wells, and the mild version is FCAS, which is the familial cold-associated autoinflammatory syndromes. So the mild forms usually just come with conjunctivitis. The Muckle-Wells has more severe disease, and so we see the disc edema, the posterior segment abnormalities, corneal disease, and recurrent conjunctivitis. They have autoimmune-related findings, including the hearing loss, the childhood-induced cold urticaria, the recurrent fever disorders, and in the severe form, the NOMID, they have multi-system involvement, and so they present in infancy. The genetic tests are for the cryopyrin gene, and we have these genes for the cryopyrins. You can look that up later to see what the genetic panel is, different types of cryopyrin abnormalities. And the cryopyrin is what causes the inflammatory disease, because it's involved with the formation of a complex called an inflammasome. So the inflammasome is what causes the inflammation, and that inflammation is what is accounting for the urticaria, the fever, the hearing loss, and the uveitis, both in the anterior and the posterior segment. So you should be thinking about cryopyrins when it's cold and hot. Cryo, cold-induced urticaria from childhood. Pyrin, recurrent unexplained fever. Inflammasome, inflammatory disease in the ear, hearing loss, and in the eye, conjunctivitis, uveitis, optic neuritis, optic disc edema. Three forms, mild, moderate, severe. FCAS, Muckle-Wells, the medium one, and the severe forms, the infantile forms, NOMID.